You're listening to Kerry Lutz's Financial Survival Network, where you get valuable information you just can't find anywhere else. To thrive in today's trying times, you need the Financial Survival Network, now more than ever. Go to financialsurvivalnetwork.com and get your free newsletter and gift. Financial Survival Network, now more than ever.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz, and today is Cinco de Mayo 2021. Well, what a great day to talk about Reluctant Reentry Syndrome, or as I would call it, coming out of the COVID closet. Well, sometimes you think you need your head examined because you don't know what to believe. And now the federal government, the CDC, has given its blessing for people who've been vaccinated. You can go outside without masks when walking, jogging, or biking outdoors, or dining with friends at outdoor restaurants. I don't know what they're talking about. I've been doing this all along. I guess I've been violating the CDC guidelines, but it wouldn't be the first time. Well, in any event, I'd like to get to know your thoughts about it. Tell us what you think. Email me. My address is kl@kerrylutz.com. Right now, we got a real treat. Dr. Carole Lieberman is with us now. And Dr. Lieberman, hey, I'm having a problem here wrapping my arms around all these orders, often conflicting, emanating from the CDC. I thought that a vaccine was like, you have a vaccine and then you don't worry about getting sick from whatever it is you're getting vaccinated against anymore.
Yes, I am wondering if really the aim is to help us with COVID or is to make us crazy. Because if you listen to all of the different people, from the CDC to Dr. Fauci to all these so-called experts who really don't know what they're talking about, and if they were honest and just admitted that, it would be a lot better for our mental health. But instead, they tell us different stories every day, and really the key is to not pay very much attention to it, in my opinion, because your head will spin trying to do the right. If you want to do the right thing, your head will spin with all these different changes. So, like, for example, in New York, they just announced they were going to be in the tri-state area. They were going to be opening up a lot of things May 19th. And that really didn't faze me. I mean, you can't keep believing these things. And then especially we're, 2 weeks away from that. And if there's a new strain that comes and starts infecting New York and all that, that's going to change. So you really have to gather the information from a number of different sources with different political beliefs and make your own opinion, make your own decisions.
Yeah, well, you hear Mr. Dr. Fauci, he says you need 2 masks. Maybe you need 100 because you just can't be too safe these days, can you? And then
yes, and I'm sorry.
And then you look at Texas, they get rid of the mask mandate and their rate goes down. Florida is getting rid of it as of July 1st. I am going to change in my calendar. The new Independence Day for me is always going to be July 1st, the day that Governor DeSantis freed us from the mask mandate.
Yes. It really, and the idea about New York opening in the middle of May when July 4th is, or same thing, here there are going to be a lot of tourists in July. You just can't let other people tell you what to do when they really don't know the answers. That's the fact.
That never stops them from telling you what to do, though, does it?
That's right.
Fauci has been a bundle of contradictions from the beginning. No, there's no need to have a mask. No, now you need to wear 2 masks. No, you can't get it from asymptomatic people, or there's very little risk of the virus. No, you better shut down the global economy because somebody might die. And to listen to anything that this guy says, I mean, I don't know if you caught Dr. Rand Paul tearing into him at a recent Senate hearing, but he said,
"Yeah,
look, we got people who had the Spanish flu. A lady had the Spanish flu in 1917. They did a blood test of her 90 years later, and they found that she still had immunity. we've never had a situation where we get vaccinated and they say, maybe you just shouldn't go out even though you have the vaccination. Yes, we have a flu vaccine that isn't very good. So is he saying that this vaccine is like the flu vaccine? It's kind of basically useless unless you get the exact right strain? Is that what he's trying to tell us?
Well, what the whole, if you figure it out, the reason why now all of a sudden, at the beginning it was, just get the vaccine. Now, they're saying, well, we don't know how long the vaccine is going to last. You're probably going to need another one in 6 months or a year. Why do you think that is? Because they want to keep giving money to Big Pharma.
Bill Gates, to Dr. Bill Gates, because he's so knowledgeable and has helped us so much. And then, I've had COVID. So under most circumstances, you get something, a virus, you're going to be immune to it in the future. And I had 3 other people's antibodies, from donor plasma. Why do I need a vaccine that they say isn't going to work or may work when probably my immunity is going to be better than the vaccine? Because we've seen that the recurrence rate of COVID-19 is very, very small, smaller than put it this way, 99% people who had COVID aren't going to get it again. And yet 97% of people who get the vaccine, 3% are going to get it anyway. Maybe my immunity is better than what they're selling.
Yes. Again, if they, what's sad about this and scary about this, and more scary than COVID, is that people are putting their political and their financial agendas, including perhaps primarily Dr. Fauci, but others, ahead of the actual health of Americans.
Yeah, it's so true. I mean, I'm looking at numbers here. I don't know how reliable this is. Becker's Hospital Review saying that the reinfection rate's around 0.4%. So it sounds like I'm more immune than people, and this is as of April 26th. I'm more immune than somebody who got, if they were really paranoid and they're stupid and they got all 3 vaccines, a total of 5 injections, I think I'm probably better off than that person if they're still alive, right? It's really kind of disheartening. I mean, there's a study done here. 400,000 patients had at least one positive result. And of that, 37,000 had 2 or more positive results during the study, but only 0.4% of the patients had a subsequent positive test at least 30 days after their initial positive test. There's something screwed up here. We don't know enough about this. Don't you think it would have been interesting to study people who've had COVID before to get an exact number on how many are going to get it again or got it again?
Yes. Well, I mean, of course, all of these studies would be helpful, but then they would get in the way of getting people to get more vaccines.
Oh, okay. So now the medical profession, they're vaccine peddlers. It's not bad enough they're pill pushers. And
right.
But one thing you talk about in your notes here is I think if you ever saw that movie, The Shawshank Redemption, and the guy gets out of prison and he's been institutionalized for 40 some odd years and he can't deal with the freedom. And he goes into the hotel room and he takes his belt and he hangs himself. I mean, is that what we're going to have here? This COVID syndrome of reintroduction into society, like you call it, reluctant reentry. And we'll have people hanging themselves because they like being locked up and having Big Brother telling them what to do?
Well, there is an increase in, there has already been an increase in suicide, and it is for various reasons. Like before now, it was for reasons like being afraid of catching COVID or being locked down for so long, various reasons as the different phases of this go on. But for now, yes, I have developed the 10 symptoms. Not I have developed. I mean, I don't know. I actually have some of them myself.
Yeah. That's all right. Well, you know what the biggest cause of suicide has been throughout this whole thing? Is watching Dr. Fauci tell us what to do. I mean, if that doesn't make you want to kill yourself, I don't know what does. But you said,
that's right.
But there are people, and I mean, people get angry at me because I always said, I'm just going to live my life. I don't care what the government says. Let them arrest me if they don't like me being outside. Luckily, Florida kind of backed off on the whole lockdown thing relatively quickly. That's why the state's doing so great. But things like, I guess people really don't want to leave their homes now, right?
Don't just survive, thrive. The Financial Survival Network.
Today's show is brought to you by GR Silver Mining, ticker symbol TSX, GRSL, OTC, GRSLF, and their website at grsilvermining.com. The company is extremely well capitalized, currently has a resource of 40 million ounces of silver, and is looking to triple that number in just the next year alone. Its management team is first rate, headed up by Marcio Fonseca, a geologist with vast experience in mining operations and the financial sector as well. With all this going for it, and with silver trading over $25 the ounce, there's no telling how high GR Silver Mining will go. So go to grsilvermining.com to stay up to date on the latest developments and get on their notification list today.
This is the Financial Survival Network, the information you need to thrive now more than ever.
Well, so let me tell you about these symptoms so that your listeners can decide if they have this or not. It's kind of like when you are at a pool, holding on to the side of the pool for dear life, afraid to get wet, to jump in, or on a diving board, afraid to jump. And even though we have been saying that we want to get out of lockdown and so on, we've been complaining about that. But then when it really comes down to it, a lot of us have this reluctant reentry syndrome. So the first symptom is a vague discomfort about discovering what the new normal will turn out to be. Everybody has been talking about the new normal. Nobody really knows what that's going to be like. And so it's scary to walk out of your house and into something that you don't understand or don't know how to navigate. And then the second one is dreading the pressure of FOMO, fear of missing out. As more things open up, you start feeling pressure to be a part of it. You know, restaurants, for example. Oh, I haven't been in a restaurant for a long time, and my friends are getting together. So it's like you feel like you might want to go to a restaurant. Restaurants are nice, but it's a pressure of feeling like you have to do this because everyone is saying that that's what we should do. Number 3 is a reluctance to get out of your comfy pajamas. 4 is not wanting to face the world after you've let yourself get fat and furry. 5 is agoraphobia, fear of being in crowds. Now, what that is, that's something that people had long before. I mean, some people had long before COVID, but it's a fear of being in the middle of a crowd. It really literally means fear of the marketplace. So fear of being in crowds and feeling like, if you need help, nobody is going to get to you. You're going to be swallowed up by the crowd. So we feel. Yeah,
so that's different than arachnophobia, right?
Yes, right.
Fear of spiders.
There are spiders in the crowd.
Well, there could be, there's a lot of people. There could be a lot of spiders. And, if you've got agoraphobia and arachnophobia, man, you just better stay inside and never come out because it's just never going to be good enough for you.
Yes. So, of course, now that we've been wearing masks and been told to stay at least 6 feet away from other people, well, there's more of a reason to be afraid of crowds. Fear of catching COVID-19 because, we know that there are a whole bunch of new strains and it's questionable whether the vaccines protect us from all of these new strains. Then 7 is dreading the awkwardness of reconnecting with friends, family, and colleagues. At the beginning of the pandemic, we were calling, reaching out more and calling our friends and family and colleagues to check up on them, make sure they're okay. But, as the pandemic has gone on and we've gotten sick of Zoom and all of this, we've really folded in on ourselves more. And so now we have to see them again. And so it's sort of awkward when there's really no excuse that you have for not having been in contact, perhaps for months. Then there's no longer the excuse of lockdown to explain why you don't have a partner. During lockdown, if you didn't have a partner, you could always say, well, how am I supposed to go out and find one when we're supposed to be locked down?
The ultimate excuse.
Yes, but now you don't have that excuse anymore. Then if you have kids, you'll have guilt over releasing your kids back into the scary world. A lot of parents, there is no clear answer as to how safe it is to let your kids go back to school. I mean, we know that mentally it is better, and learning-wise, it is better for kids to be in school. But, and so far, the tests seem to show, studies seem to show that it is safe. But, parents are not so sure about all of that.
Well, the death rate for kids is like near zero from COVID.
Yes.
And the infection rate. And that's why they should have never shut the schools down. But anyway,
yes,
what else
that's
we got?
right. They should never have shut the schools down. But there is a syndrome, an inflammatory syndrome that kids are getting. So there is some question. But, and then last but not least, realizing you don't want to go back to your old life, but not knowing how to reinvent yourself. So this is really an opportunity. The lockdown and COVID, this whole pandemic, has really given us an opportunity that we can take. We don't have to go back out into our same lives. I mean, some people have more options than others, but we all have, to some degree, we can decide what are the things that we really do miss. Who are the friends we miss? What are the hobbies or the organizations that we belong to that we really miss? Is there something else that seems more important now that we should be spending our time doing? Is there another job? Should we change careers? Maybe we were fired or laid off, or our business, we lost our business because of COVID. This is really a freeing opportunity.
An opportunity that seldom comes in one's life to reinvent yourself. I got to tell you, like, I'm going down your list here, this top 10 list. I have none of this. I have none whatsoever. Really? When we were locked down here for a month and a half, the day that everything reopened, I'm in Palm Beach County, and Palm Beach County South was all locked down, but the county to the north of me was Martin County. The day that the restaurants reopened, I was out there having dinner the first night that things opened up. And I hadn't been in this county, Martin County, for a year and a half. I had no reason to go there. I was there 3 times that week. Now, I made the decision I was going to have a great time, and no matter what, I wasn't going to let them, rain on my parade. And I found this to be one of the best years I've ever had in my life. So I guess I'm strange that way, huh?
Well, no, that's good. I mean, I think part of that was because you were making a political statement.
I don't know. My political statement was, you're here for a limited amount of time. Who knows how long this thing's going to last? I got a 1% chance of dying from it if I get it, and probably a 20% chance, maybe 15, 20, maybe a third. So the odds of dying from it are extremely low for me. And why stay home and worry about this? And then the nature of my business just improved overall. But I feel like I came out better than most people did, because I had COVID. I assumed the risk. I got it. I got a bad case of it, but I survived. But you know what? I lived, and so many of you out there were hiding under your beds and worried you're going to die. Now, if I had really bad comorbidities, serious diabetes and etc., I might not have been so gallant. But the fact is, I'm in pretty decent shape. Not good enough, obviously, but I've taken it as an opportunity to improve my health further after having gotten it, and I have. So I'm in better shape now than I was before I got COVID. But enough of me. Point is, I guess you made a decision when you heard about it to either live or go into hibernation mode. And all too many of you out there, if you were in hibernation mode, then these are the things you're dealing with, right?
Yes, well, it also can be some simple things like when we were in lockdown, and you didn't have to go into, many people didn't have to go into their workplace. And now that we do in a lot of businesses that are opening, you have to confront things like the traffic and just all of the different. A lot of people have gotten so comfortable being at home, and especially working at home, and being with one's family at home, and so on. That it seems that they are reluctant to give that up, and with some good reason.
Yeah, well, that work from home thing had a lot of benefits. Interesting thing, Dr. Lieberman, economically, assuming you managed to keep most of your income, the things that you could spend it on were so dramatically reduced. You couldn't travel. Restaurants were difficult, certainly for a while, and a lot of other things that you might otherwise be spending your money on if you managed to keep your income where it was. And a lot of you couldn't, obviously. But if you could, then you wound up saving a ton of money, just not going out to restaurants all the time, not traveling. Yeah. A lot of other expenses that you would have otherwise incurred, you didn't have to incur them. So maybe economically, a lot of you are better off too.
Yes, I think it varies. I think it's one extreme or the other. Some people being better off, and some people who lost their jobs or were laid off. It's worse. There is a lot more disparity, I think, since the pandemic in general.
Yeah. It's definitely widened the gap. So let's assume we're going to go back to some semblance of normal, all right? How do you deal with the syndrome here? Medication, alcohol, drugs, meditation.
Or all of the above.
Yeah.
Well, I think the thing is to decide for yourself that you are not going to be pressured. Some people may have not have a choice as far as that. If their place of business is opening up and their boss says you either come back or goodbye, they may not have a choice in some things. But the idea is to take very gradual steps and really make conscious decisions, not just falling back into what you were doing before. Make conscious decisions about everything, whether this is something that you feel, whether you're in your dream job, for example, or whether you really want to take a risk and try something else, or whether you want to make new friends, or, just everything that you are tending to automatically go back to do just because you did it before. Rethink that and decide if this is really something that you do want in your life. A lot of people moved during the pandemic, like from cities to more rural places, for example. That's great. If that, it's like starting over. There are really lots of advantages to starting over. Not that, it depends. It's different for everybody, but a lot of times we get stuck in a rut, and this is an opportunity to break free.
All right. I think we'll leave it at that. Use it as an opportunity for growth rather than a negative. And remember, you don't want to wind up like that guy in the Shawshank Redemption hanging from the rafters because you can't deal with it. Get some help if that's what you need.
Yes,
and,
absolutely.
Dr. Lieberman, how do we connect with you, find you on the web?
Well, you could go to my Twitter page, which is at Dr. Carole MD, at DrCaroleMD, or one of my websites is drcarole.com, which is DrCaroله.com.
All right. Excellent. And there's links to that in the show notes on financialsurvivalnetwork.com. Make sure you sign up for our free newsletter and send me your thoughts about coming out of the COVID closet. Love to hear about it. My personal email address is kl@kerrylutz.com. Dr. Lieberman, always a pleasure. Thank you so much.
Thank you.
Thanks for listening to Kerry Lutz's Financial Survival Network, your solution to today's trying times. For the latest, go to financialsurvivalnetwork.com. Financial Survival Network, now more than ever.